You are watching Access LaPorte County, Channel 97. Coming up next is the February 25th meeting of the LaPorte County Board of Health. You can find more information for this meeting by visiting www.accessLaPorteCounty.org.
Okay, I'm going to call the meeting of the LaPorte County Board of Health, February 25th, to order. And we're going to start with the roll call, but before we do, I'm going to introduce a new welcome guest and member of the Board of Health, Dr. Adrienne Pink.
Welcome.
Welcome. All right, so let's do the roll call.
Good afternoon, everyone.
You got to get to the mic, Jules.
Absolutely. Okay,
And then turn it on, too.
it's on. Okay.
Okay,
A little bit?
if you say so. I can't hear you.
Okay. Mrs. Arnold? Here. Dr. Uhas?
Present.
Ms. Lawn? Here. Dr. Manning Cox?
Here.
Dr. Nelson will not be joining us this evening, but Dr. Pinks? Here. Very good. Thank you.
All right. So, we have a quorum. Very good. It's time for the election of the new officers for the year. And I will entertain recommendations, but I will put up Allie. How do you say your last name?
Lawn, like laundry.
Oh, okay. I always Lowy and all. Lawn. Allie Lawn for chair. And I need a second for that.
I'll second that.
Okay. Any discussion on Allie Lawn? If not, we could proceed to a vote. All right. Now, with Amanda on video, do we all have to raise our hands? And
I'm not a voting member, doctor, so we don't have to do that.
I just didn't know. I didn't want to offend you.
Oh, not at all.
All right. All right. Let's take a roll call then on Allie for chair. Dr. Cox?
Here, yes.
In favor?
In favor, yes.
Okay. Let's just go down the table and
Lauren Arnold, yes.
Dr. Uhas, yes.
Allie Lawn, yes.
Dr. Pinks, yes.
All right. Congratulations and welcome.
Thank you.
All right. And now we need a vice chair.
I would like to nominate Dr. Yohas as the vice chair.
Oh,
I'll second that.
I'm touched.
We haven't voted yet.
For me?
Touch or bad touch?
Okay. Dear Lord. All right. So with that having been universal for me, let's take a vote. We'll start with Dr. Cox and go down the table. All in favor?
Yes.
Yes.
Aye.
Definite aye.
Yes.
Okay. No further discussion. Thank you for your trust and confidence. So we have a chair and a vice chair. And we work well together. So that's cool.
Don't tell her about all my late night calls, doctor. She might change her mind.
I'm a late night person. That's fine with me.
No, I approve of that. I approve of that. At 3 a.m., it's just fine. All right. Now, selection of legal counsel. Do we have any names to put up for that? I will put up Shaw Friedman and Associates.
I will second that nomination.
Any discussion on that? If not, I will entertain votes. Dr. Cox?
Georgetta Manning Cox, yes.
Lauren Arnold, yes.
Aye.
Allie Lawn, yes.
Dr. Pinks, yes.
Okay. Thank you for your hard work and looking forward to working with you for another year. Okay. So that's the selection of legal counsel. Approval of minutes from whenever our last actual meeting was. Not so much when we showed up, but when, we had a quorum. All right. So does anybody have any comments about the minutes from November?
I move that we accept the minutes as written.
Yeah, second.
Yes, we have a second. Then let's vote. All in favor?
Aye.
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 Okay, moving right along, the November
For
21st.
you, Haz, I
Okay.
don't mean to interrupt, but Ally is now president.
Oh.
If you wanted to hand the reins over to her to, since
That's
she's
hard to
present, and to run the meeting.
I'll take
You run the meeting, okay.
take those reins.
Jeez.
Oh, she
Oh, she gets
entrusted me with
the
the gavel.
hammer too.
I
I
get a-
gave that up, I didn't know.
I wield the
I would have fought harder.
So, did we accept the approval of the minutes for November 21st? I believe we all
Yes, we did.
accepted that. All right.
Yes,
So, please, in the notes, accept the approval of the minutes from the November 21st meeting. Now, on to the next, which is the approval of minutes from January 14th, as printed and sent to us. That meeting we didn't have enough for quorum for that day, did we?
No.
Okay. But we still I still need a motion to accept those minutes of that abbreviated non-meeting.
I make a motion to accept the minutes from January 14th of 2025.
Second.
Okay, we have,
So we have a motion and a second to approve the minutes for January the 14th. Everybody please say aye in order.
Aye.
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 Okay.
All right, ayes have it. Fantastic.
Perfect.
Now on to public comment. If you are making a public comment, please come up. Make sure your speaker is on and start with your name and your city of residence, please. Do we have any public comment? We have a few people out there. You don't want to say anything? No? Okay. All right. Well, shall we have a motion to close public comment?
I so move.
Second.
All right, we have a first and a second. Closing public comment, please say aye or nay in order, starting with Dr. Manning Cox.
Aye.
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 All right, on to the reports and discussions. I would like to hear the health officer's report.
What you've got here is outdated, so I've got some other comments. And I know that, microphone. As I said, it's outdated, but I do have some other comments, and I know that Jenny's got information again about the bird flu and that, so between the two of us, we'll get through this. So bird flu, as everybody knows, is quite widespread and is affecting the price of eggs, which is an effect for everybody. There's still only been one death, and as far as we know, the only death that has been by mutated viral gene for this, so hopefully that will stay. There's still no record as of a week ago that I've seen as any person-to-person contact. This is all either bird to bird, bird to mammal, mammal to, like, poultry workers, of course, have been affected, and so have the dairy workers, but it's been from the herds that they work with or flocks that they work with, not from somebody else.
So did it jump from the bird population to the humans, or?
No.
Okay.
Oh, sorry. Ask that question again. Yes. I mean, humans are getting bird flu,
Avian flu, yeah.
but it is coming from birds or from mammals, not from. I'm not going to give it to you. That type of thing. There's been no evidence yet of person-to-person contact.
And do we have any bird flu in Indiana? Have we had any in LaPorte?
You've got all those numbers, don't you?
Oh,
Yeah,
fantastic.
okay. So it's still obviously a huge issue, and if you look on the CDC, they talk about how many herds are affected, how many
Doctor,
flocks are affected.
can you move your mic towards you?
Yep.
Thank you.
So how many flocks are affected? They've got all the listing. I didn't bring all the numbers, but it is significant. So I think
And
that's important.
is killing them the only way to control the infection, killing the birdies?
Yeah. As far as I'm aware, I haven't heard of anything. You're probably better answering that than I am, but to the best of my knowledge, there's been no treatment found to stop this. And they talk about the number of humans that have been affected, but the suspicion is that it's significantly higher than the reported cases, because so many of what people get is they get a little pink eye and don't even think about work, especially back before we really knew about bird flu. But there still doesn't seem to be human to human. It has not mutated to spread from one human to another yet.
yet. Doctor, is there anything we can do to help the birds or?
I believe Zoetis is developing a vaccination for chickens and poultry for avian influenza. I don't know if there's any backing on it or anything yet, but no.
And it's not available.
Yeah. I mean, they've slaughtered a lot of them.
Yeah, culling, I think, is
600 million, I believe, was one of the last numbers I saw, what was thought to be the number of birds that have been either slaughtered or died. And again, that's probably a way undercount, because when you think of all the birds out in nature, plus the fact is, does everybody count every chicken that they have to let go? So there's probably even more than that. It's huge.
And this is tied into our egg shortage?
Yeah, there's no,
There's no egg
chickens,
producer.
there's no eggs. So,
Wow.
yeah.
Question, how do they dispose of all of these?
You know, I think it's probably different things from different ways, but I know that a lot of it, as they've been incinerating a lot. You might know more. I don't have any farming friends, so
I believe incineration and then burying.
some, but incineration's a big part of it.
Does it go to domestic animals at all? Cats, dogs?
Yes,
Yeah.
cats. It's
Yeah.
deadly to cats. In most cases of cats, I think there's been 4 or 5 deaths associated with the avian influenza in cats, and it's cats that are fed primarily a raw diet.
Yeah.
Again, one of the things that they've been warning people, and again, you know more about this, is that, a lot of the raw food, because a lot of people think that the best food for dogs and cats is raw food, and I'm not going to agree with that, but
I would also not agree with that.
but they are encouraging people not to do that anymore because of this. It is being passed on.
But one thing also about cats is that they kill birds. And so people, I guess, should know that they need to keep their cats indoors.
Yeah.
It's a great idea. You got to tell my 17-year-old cat that she's stuck in the house.
So this really primarily affects feral cats,
Yes.
except the ones that go out and have a outdoor lifestyle.
Yes.
Okay.
Yes.
Okay, thank you. That's great to have you here. All right.
So back to this, when I did the report last time, I talked about COVID, RSV, and influenza numbers are increasing. That's not true mostly. 6 states still has increasing numbers of influenza, declining or likely declining in 33 states, and unchanged in 9. So it's out there. There's still people that are sick with it. Declining vaccinations has contributed to it, is the thought that from the CDC, because people are not getting vaccinated. We talked about that the last time. The COVID vaccines and RSV, influenza, all those are decreased. I mean, not tremendously with some of the numbers. It depends which state you look at. And again, CDC has the list of every state as to what the vaccination rate is and that type of thing too. Measles has been a big thing that you've seen in the news at this point right now. In 2000, there was a huge celebration in public health because they thought that measles had been eradicated in the United States. And unfortunately, that's just not true anymore. There is about 100 cases, not quite, in 8 different jurisdictions. They've got several outbreaks into different different states and different counties in different states. Of the ones they've had it, 95% of people, mostly children with this, have not been vaccinated. 0% have had the 2%, or the 2 vaccines. I think it was 2008 or 9, bear with me, but the original recommendation for children was 1 dose of the MMR. And then the decision was made to give them 2 doses because, again, it was thought to be safer. There have been a couple cases of children with just 1 MMR that have gotten measles, but no cases for children that have had the 2 MMR. There's been multiple hospitalizations. 25% of the kids under 5 that have got it have been hospitalized. And I don't believe there's been any deaths. I looked again today, and I have not seen any current statistics of deaths right now. I mean, obviously, kids have died of measles for years and years and years, but I've not seen any from this outbreak, and I may have missed that, but I looked pretty hard today. So it's in the number of vaccinations is right now is about 90%, 91% of children have vaccines. So I mean, it's still a really good number, but obviously it's not in areas where people have chosen not to vaccinate, and it is deadly in kids very frequently. So I think that's kind of what I have to say at this point, unless anybody has any questions. Any more questions?
Have we lost herd immunity?
No,
Okay.
have not. For different, are you talking about measles specifically, or?
Well, yeah, measles right now.
I think the answer is yes, because there's still 90% of kids are vaccinated, and again, there's no kids that they've seen with measles. So if you don't get measles, you don't pass it on to somebody else. So these are mostly in small communities that are resistant to vaccines. The grouping, there's been several different cases in each, I think there's 8 different states that have it right now. And it's not like one here, one there, one across the street. It's all on the same street kind of thing, or in the same small school, different types of things like that. Huh. So the answer is we still have herd immunity. If you've got a high enough rate of vaccination at this stage for measles, if you are in the right herd, you're okay. If you are in a school where the kids are not vaccinated and one gets it, then you have the risk of getting it. Does that answer the question? That's kind of a yes and no. It depends where you live.
I'm happy with it.
Yeah.
I have one more little question. It's about the COVID booster.
Mm-hmm.
Is it out of stock?
I don't think so.
Because I went to a local chain, I will not mention which, and I went to get my booster, and they said, we don't have any. I said, well, when are you getting some? They go, we don't know. And I go, you don't know? She goes, yeah, we were just on the phone with the company. They don't know. Now, this was a couple of weeks ago, and I haven't had a chance to waddle back there, but as far as you guys know, Ginny, the COVID booster, the one. Oh.
I was at
nice sweater. Can I come up and get a booster? No.
So
I gotcha.
Is there any other questions?
What?
I said any other questions or concerns?
Yeah.
So just don't go to Texas if you're not, if you haven't had your measles vaccines as a kid. I think that's probably the best recommendation I can do. That's where the biggest outbreaks are right now.
All right, parliamentary question for our attorney. Now, we do still need to accept everybody's reports. All right. I am open to, who wants to make a motion to accept the health officer's report?
Dr. Pink?
Motion to accept?
Good job.
Second.
Fantastic. We have a motion on the floor to accept the health officer's report. Please, down the line, let's either aye or nay.
Aye.
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 All right, on to the administrator's report.
That would be me. Thank you.
Chairman Amanda.
Glad to have you all here with us today. And I just want to point out, I guess I've noticed it before, but being on Zoom and looking out across the room, that it is a room full of women that are in charge. And I love that. So, so happy to have a female-dominated board. Girl power. Oh gosh, that's on TV, isn't it? Okay.
Be down in EEOC.
Right. So the fourth quarter of the year is always kind of a slower month. I should say, we don't have budgets to worry about. That's all done and taken care of. That stress is over with. Our big thing is getting food permits out and trying to wrap the year up. I wanted to bring attention to one of the programs that we've put into place, and it really is thanks to our emergency preparedness coordinator and school liaison, Danielle Glasgow. She has been working very hard over the last several years to get this started in the county, and that is the Stop the Bleed campaign. As you can see, and with the several doctors on the board there, that the average time to bleed out in an emergency is 3 to 5 minutes, and the average time for first responders to arrive on scene is 7 to 10 minutes. And given that LaPorte County is also a large rural area, a large community, that could be even longer than 10 minutes. And unfortunately, in today's society, we really felt that we needed to bring this program into the schools. So we started with, or I should say Danielle started with her first training session in last August at our annual school nurse conference. Since then, she's done 8 training sessions and have so far trained 87 people and with 67 kits provided. In the next couple of months, she's been able to get more schools on board. In the next 2 months, there's going to be another 146 people that have signed up to become trained and save the bleed. So that's going to make a significant impact on the community. Hopefully nobody ever has to use it, but it will be there if needed. But she has trained several of the police departments. I believe the entire sheriff's department is now trained, and we have provided kits too. And we are carrying the cost of the kits through our school liaison program that we received money from a couple of years ago from the state. I also threw in there at the end what we bring in each year. You can see what the funds that we are bringing in, the money that we are bringing in. We are self-funded more or less. We do receive that money from the grant or from the state for our funding for the Health First Indiana. We get a levy from the county that's dedicated to the health department that has been cut back significantly because of the Health First Indiana funds. But everything that we bring into the department that we generate, we keep. That goes into our health fund. It's the 1159 fund, and we use that money to also operate the department. So just to give you an idea of what we are bringing in and where exactly that is coming in from. We keep all of that except the right-hand column where it says Coroner's Fund. Every every death certificate that we sell in the office, I think, Julie, correct me if I'm wrong, I think it's up to $2.50 now from each certificate goes into the state's coroner's fund. So that's why that's $15,300 some odd dollars that all goes into the state coroner's fund. And that's through legislation. We don't. Every county has to do that. Briefly to touch on bird flu because it did come up. So bird flu has been identified in just about every county in the state. It's assumed to be present in every county. The DNR was in the paper several weeks ago that bird flu has been identified in, I believe it was a goose, in LaPorte County. So we do know that it is here for sure. It affects primarily waterfowl and domestic poultry, and that is hitting us harder. You can see that now from the egg prices, but I don't know if you know that Indiana is the second largest producer of eggs in the country, so that's going to be hurting some people here, unfortunately. It's hurting us, right? But it's really going to be hurting those farmers. I did send out an email, and I'll talk more about it at the next. It'll be in my next report for this first quarter of the year. But since I did send that email out about the Health First Indiana funds, I talked about that multiple times over the last year about us being able to have funds to for community projects and to get money out into the community to help with those core public health services and to fill in some of those gaps. So the application was posted yesterday on our website. Applications period is open until April 11th when we will close it. We will be rewarding a significant amount of money, hopefully. That does have to be spent by the end of the year. But we've had several inquiries, and I'm going to be very interested to see some of the proposals that we get in the applications. So, can I answer any questions for anyone?
All right, seeing that there are no questions, can I get a motion to accept Amanda's report?
So move.
Second.
All right, we have an open motion on the floor to accept the administrator's report. Please say aye or nay in order, starting with Dr. Manning Cox.
Aye.
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 All right, on to the next nursing supervisor's report. Jennifer.
Good afternoon.
Hi, Jennifer.
Hi. Going back to the fourth quarter, which seems like a long time ago, but it was a productive fourth quarter. We did a TB testing clinic for LaPorte High School CNA students at a discounted rate to maintain their compliance with their program requirements. Peggy Rose and I participated in the Alliance MD Open House, and we were available for HIV and syphilis testing at that event. Excuse me. We tested one participant at that event. Alliance MD is an outpatient treatment center for substance use disorders. We also did an on-site clinic the fourth quarter of last year at Head Start for capillary blood lead testing. And we were able to utilize our, excuse me, our new point of care lead testing machine at that clinic. So I think enough has already been said about bird flu, but I did want to point out that I put a couple of pieces of information in your packet in case you wanted to learn a little more. The one thing was just a guide on how birds spread flu to people. And on the back, it has some bullet points about bird flu in poultry and in people and outbreaks, and that's from the CDC. And then there's a page on signs and symptoms of bird flu also. And as you can see, it's a lot like the regular influenza that people get seasonally. But the eye redness is kind of a little bit different in avian flu. Let's see. And I do want to say a little bit about mycoplasma pneumonia, just because we're seeing and hearing about more cases. It's not reportable, but we are hearing about more cases of it being present, especially in children, which is unusual because normally children age 2 to 4 years old don't normally get this, from what I understand. It's found more in older children and adults. And they found that since the pandemic, it's had a kind of a resurgence since the COVID-19 pandemic. And the CDC is monitoring the situation through data and sentinel flu reporting systems to try, surveillance systems from syndromic surveillance to try and track where they're seeing this and what populations they're seeing this in. So I do have a little handout in your packet about that as well. And the fourth quarter report, we did 198 clients. We vaccinated 198 clients and provided 396 immunizations in LaPorte. We saw 218 clients and provided 450 immunizations in Michigan City. And then we had 68 clients and 72 immunizations in other clinics that we did for vaccines. a total of 484 clients and 918 immunizations in the fourth quarter. For our laboratory services program, we saw 16 clients in LaPorte, 5 clients in Michigan City for a total of 21. 66 communicable disease reports were reported. We did 4 Cribs for Kids education classes and provided the Safe Sleep crib for 4 clients in need. We tested 8 clients at the health department for lead and followed up on 16 outside elevated levels and provided 3 home evaluations. We did 115 TB tests and 6 clients for travel immunizations. And also in your packet, I provided a little bit of information about measles, just in case you wanted a little more information besides what Dr. Ducey spoke about. There's also a news report that Julie provided to me I thought was interesting, so I provided that to you as well, just to kind of give you a little history of the Texas outbreak. And I do believe that was spilling a little over into New Mexico, so hopefully it gets under control soon. Any questions?
Seeing that we have no questions for our
Nursing supervisor.
new nursing supervisor, thank you, sorry. I need a motion to accept her report.
I move to accept the nursing supervisor's report.
Second.
Fantastic. We have a motion and a second. We just need to vote on accepting her report as written. Can we start with Dr. Manning Cox?
Yes, aye.
Yes.
Aye.
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 All right, so we have accepted the nursing supervisor's report. Next would be the environmental health food division supervisor's report. Is our environmental health food supervisor here?
Unfortunately, Trisha's not there tonight due to family illness.
All right.
So I don't know if anybody had a chance to review her report. And if you did, we can try and answer any questions that you may have.
So shall we, how do we carry on with this then?
We normally just say, do we accept the report
As written and-
as written, and unless anybody has an objection.
All right, I'll just give 3, any questions on the written supervisor's report? Going once, going twice? All right, can I have a motion on accepting her report as written?
I so move that we accept the environmental health and food division supervisor's report as written.
Fantastic.
Second.
And Dr. Manning Cox is the second. Let's vote to accept with either an aye or nay, starting with Dr. Manning Cox.
Aye.
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 All right, on to the attorney's report.
Thank you. Okay, I only have one case pending. It has been pending for several months. Luckily, the woman who has power of attorney is working with the city to get running water hooked up, and electricity has taken longer than we had hoped, but it is finally moving forward, and everybody is doing remarkably well. So that's a good thing. If we can avoid litigation, we want to. So the idea that that's moving forward is good. Last report I received, they were going to open it up for inspection from the county health department again, so we could go in and monitor the improvements made. But Trish isn't here, so I don't know what happened with that. That said, I haven't received any negative reports, so I'm cautiously optimistic that it's still moving in the right direction. Sometimes we did have a backlog because of the weather, getting the electricity and everything, and then running water hooked up and the well inspected. There was a little hiccup there, but everything seems to be moving in the right direction. So we're not going to push it unless the inspection comes back that there's a problem. So until we hear from that, I'm just going to let it lie for a while and see where it goes. But so far, we're optimistic. Any questions about this or any other matter?
Sounds like the attorney's report was a good one, so that's fantastic.
Thank you.
I need a motion to accept the attorney's report.
So move.
All right, and I need a second.
Second.
Lauren, give us our second. And I need a vote on accepting the report.
Rita Manning Cox, yes.
Aye.
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 Aye. Aye, aye, aye,
All
aye.
right, now we're moving to the new business, of which I have nothing written. So there's no new business, going once, going twice. Can we skip right on to old business then, or do we need to accept that we have no new business? Because, all right, no business, all right. Old business, any old business? None? All right, fantastic. So we move on to the best portion, which is the decision of when our next meeting will be. I see that we have some suggested dates here of April 15th to be the next one. Does that work for everyone here? 'Cause April 15th? I don't know. Okay. Should we be working on all of these dates, or should we just accept one at a time? Oh, we did already? That was...
Meeting that wasn't.
Those dates were accepted previously.
Fantastic. All right.
Okay, so that's a done deal.
Fantastic. Good. So our next meeting will be April 15th, same time, same place, which is 4 p.m. at the Annex building where we are currently. The meeting after that will be July 15th. I'm assuming at 4 p.m. as well at the same place. And the next one after that will be October 21st. So all of our public fans can watch us then. I need a motion to close the meeting.
I move to close the meeting.
Oh, thank you, Dr. Uhas, and I need a second.
Second.
Thank you, Dr. Pinks. And starting with Dr. Manning Cox.
Aye.
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 All right, this meeting is now closed.